We begin tonight with the first in-depth look into the scandal that is rocking Veterans Affairs. Reports of secret waiting lists, long wait times, even deaths cemented in a nationwide audit that states over 100,000 veterans have been impacted by problems plaguing the massive government agency. As more heartbreaking stories come to light and more taxpayer dollars go to fund this agency, should Americans demand that veterans care be privatized? Let's bring in Jessie Jane Duff. She's a senior military advisor for Concerned Veterans for America, herself, of course, a veteran, and former healthcare executive Stan Hupfeld. He is the author of the book Political Malpractice: How Politicians Made a Mess of Health Reform. Thanks to both of you for coming in. And first, Stan, I want to start with you. I went through the audit, of course, this afternoon when it was released, 54 pages. I was shocked to see this. And I want to ask you if this would happen in the private sector. 13% of scheduling staff that were interviewed said they received instructions from supervisors to enter in the desired date field, a date that was different from what the veteran has requested. Change the dates that the veteran had put in there, basically to cover up the problem. Stan, would this ever happen in the private sector?
Well, it could, but I would doubt it. You know, we do have to figure out what upsets us more, the fact that there are service delays, and are the service delays because of inefficiencies or ineptitude, or the fact that we lied about it. And they're actually two different questions. Well,
I mean, let me start with that. Should we privatize the VA, Stan, yes or no?
I think we have to begin to look at that. There's about a 20 to 30% excess capacity in the civilian system that probably could be taken up with some VA patients. But there's some basic questions we got to answer first, and one of those is, what do we owe our veterans? And that hasn't been discussed yet.
Okay, well, let's ask Jessie. Jessie, what do you say to that? What do we owe our veterans? Obviously, we owe them more than what they've been handed.
Well, fortunately, right now on the Hill, they are talking about allowing veterans that have waited over 30 days and live 40 miles outside of a VA medical center the opportunity to go into private care. I think this is critical, and this is huge. It is going to break up this government monopoly on the veterans' care. These veterans are now going to have an opportunity to get into private care if these bills pass. It's Sanders, McCain, and Rubio. They've come together. I am astounded over this and very excited over this opportunity for veterans.
Okay, but let me ask you this, Jessie, and I'm going to ask the same question to you, Stan, as well. So listen, because I was looking at what Senator McCain and Mr. Sanders want to do here, Senator Sanders, and they want to add in $236.9 million to lease or build 27 new major medical facilities in 18 states and Puerto Rico, and of course they want to overhaul Phoenix, which should be done. Right. Stan, to you first. This is more money at the problem. This is going to be taxpayer money. Is that the solution?
Well, we don't, unless we answer the question, is this a supply question or is it a demand question? And we have to answer both. If it's a supply question, yes, that does seem to help. And moving some VA patients into the civilian system would be helpful. But we also got to ask the demand side of the equation. And when I say we have to ask what we owe veterans, that there's a huge difference between saying we owe veterans who've been injured, who've got a disease while they're in the service. That's one question. It's another total question to ask, do we owe veterans 40 years after their service because of chronic diseases a lifetime of care? Those are two entirely different questions.
Jessie, what do you make of that statement?
I'm sorry, those questions have already been answered. This is a mismanagement problem. We already know this. The executives have gone in and fumbled around with the numbers so they could get bonuses. That's the biggest part of the problem. The bill that I'm talking about will hold the executives accountable. Now, you did bring up a point about Bernie Sanders. Yes, he wanted to have a pork-filled bill that was going to be $30 billion. This new bill with McCain is bringing that cost factor down. We're not looking at $30 billion. We're roughly looking at maybe $1 billion. It's still going to go up to markup, and some of that money has already been allocated. The VA's budget next year has been designated to be $160 billion. So in markup, there will be some pushback. We do have a lot of people that are hesitant to add more money on. I don't think this is a medical facility issue as much as it is a management issue.
Okay, well then let's talk about Acting VA Commissioner Sloan Gibson. Stan, to you first. Is he the right guy to take this over? Remember, the Cleveland Clinic CEO, his name was in the running, and he said, no, thank you. I'm not interested. Now you've got Sloan Gibson, who's in the interim going to try and fix the problem. Is he enough, Stan, or do we need maybe, I don't know, an executive team? Do we need a CEO and a CFO to get this thing figured out?
You do need a whole, you do need a whole new executive team, and they do have to be very, very skilled in health management and facility management. And I think that's, you know, rather than politicians or former military people, I really think we've got to look at experts in healthcare design and healthcare delivery.
One of the things he's talking about, Jessie, by the way, is a hiring freeze at the VA. You think that's a good idea?
No, not necessarily. And I don't think that veterans have to run the Veterans Administration. I think proven executives have to run the VA. Because right now, Sloan has done some remarkable things. He's got outreach programs for these veterans with mobile care facilities. He's reached out to all the veterans, and he's trying to reach all of them who have been on the wait list. He is also ensuring that these veterans are getting expedited care. He's taken a lot of aggressive measures, including firing the Phoenix executives. So I think he's on the right track with being aggressive and assertive.
He's not waiting for Congress, Jesse. Real quick before I let you go, though, Jesse, you're a veteran. How do you feel about what has happened at the VA?
Oh, I will tell you right now, not a single veteran in America right now trusts the VA, and that's the biggest element that has been lost. It's going to take years to restore this. Sloan is one piece of the puzzle. We need more executives with the management and hospital care experience. Veterans don't necessarily understand that. I want to bring people who are qualified for the job and not the veteran status making them qualified.
So you fight for our country and you have no job when you come home and you have a screwed up health care system.
I agree. I agree.
Great. This is such a mess. Jesse and Stan, thank you very much. A great discussion on this. Of course, there's going to be a hearing tonight. We'll update our viewers tomorrow on what happens there.